No.
Can I just add a bit to that? Because
Yeah.
in Richmond, I think you're absolutely right. And I think one of the issues for us, and we're all finding this exactly, because a number of us around this table have got jobs here, but have also got residual jobs in the old system. And we were recruiting lots of people who will be in exactly that place. So they'll be coming into a new, exciting organisation and still having to do their day-to-day job. And I think that's a particular challenge. I don't know if there are any other examples of that happening, but I think that's quite a challenge for us.
No, it is. It's very unusual for us as well. You know, in many ways this change has been, you could list the way in which this change has been different, and that's a key one, I think. Kieran, I suppose that the important thing will be to invest as much capacity and activity in doing the OD and the planning of that as we are doing in the recruitment. And I will, over the next few months, sort of talk more about what we're doing around the OD stuff. I also think as we start to recruit more people, that becomes less of a risk. I think at the moment we are fairly thin on the ground, but as we get more managers in place, that will be less risky. I think one of the things we've talked about, for example, is we will be a relatively small organisation by NHS standards, even though 3,500 staff is a big number, but there should be enough senior managers to provide a contact for every member of staff. So when a new member of staff starts, they have an immediate contact with a senior manager, and in the early days that can be with a director.
Bill. Thanks, Chairman. Just going to reflect back to Joe, who was talking about the excitement really of the new organisation, what we can achieve. I mean, my team's a relatively small team, but they're sort of the kernel of the Commissioning Board Authority at the minute. Only 20-25 people, actually, all of them on some sort of secondment or a temporary arrangement. Very few of them yet, because we're in the recruitment process with a guarantee. Yet actually tangibly, there is a real sense of, that there's something very exciting and very rewarding going on here. And it is all based around that kind of rallying cry of doing something very significant about outcomes for everyone. It's about that connection into clinical leadership. It's about a passion for involving patients and understanding patient needs and local people. And that vision actually is what's keeping people going through what will feel like quite difficult recruitment processes, but actually that's keeping a real flame of excitement alive. So just to give some reassurance there.
Yeah, and Barbara. Yes, I think just an observation picking up onto the discussion about the style of the board and our operation with CCGs. I think Joe kind of alluded to this, but I might develop it a bit more. The recruitment process, particularly for our people out in the NHS, we'll have a large number of our staff will be out there in the local NHS working alongside CCGs, alongside local health and wellbeing boards, very much in the local level. We have an opportunity, I think, to involve key stakeholders in some of the recruitment processes. So, it was completely appropriate that on my panel there was a CCG leader as part of the interview panel, and I think we need to have a look at, as we recruit some of the key people out there at regional level and at the local area office level, that we start thinking about how we involve some of the people who want to partner in future in that process. And certainly that's something I think I'm very keen to develop. I think it sends some powerful signals that reinforce the conversation we had at authorisation a few minutes ago.
Joe, you mentioned earlier on about CCGs and CSSs, and I know that you've had a determination in this, because they would be recruiting at the same time, that what we'd be trying to do would be to give staff choice, not have them having to make a choice without all the options, but also to give the organisations, all the organisations, equal choice. And I know you've done a lot to keep that in line, and I wondered if you might just expand on that for a moment or two on as to how we're trying to just ensure that the recruitment processes for CCGs and CSSs run alongside the CCG one. Yes,
so the broad So the broad timetable we talked about, which was May, June for senior manager appointments and July, December for all of the staff, is a timetable that we've talked with CCGs and commissioning support leaders about. And in broad terms they're going to align to as well. I think you're absolutely right, Barbara. There's for staff in PCTs, they have some choices in this, and they can face in different directions, and it's really important that they can see what those choices are at the same time. I think there will be some challenges for some. Not everyone's working at the same pace, but there's sort of broad agreement and understanding about why alignment not only benefits the staff, it actually benefits the organisations as well.
Thank you.
Yeah, can I just reinforce one point, Jo, which is as you take on more and more people, the critical importance of having the organisational development pieces of this, I think, become more important, and that goes from induction through to the way in which performance management works, through interaction, style of working with managers, with each other, and I think it would be helpful, if I may say, Chairman, for the board to have as early a view as possible on the organisational development strategy and the components of that, to do exactly what Bill said, which is it's an exciting place to be, but how does that infuse all of the components of organisational development?
Yeah, okay.
I agree with that, and I think actually it's a matter of reassuring the board, but also trying to give us a sense of how the board can assist in maintaining this sense of buzz that Bill referred to, which otherwise does have a risk of being dulled as large numbers of people come in from different backgrounds. I mean, if this is a new organisation, to maintain that differentiation, that distinctiveness is going to be immensely important. So,
can I just say I'm absolutely excited and all that, but we just have to think about, because in a sense the context in we're working here, of course, is one of a significant reduction in the numbers of people working in this environment, and I think we have to acknowledge that, and I think as certainly part of the way we think about it is how we deal with those people who have not been successful, who've got to leave the system is important to us, I think, in all of that. And I have to say, if you think about the NHS at the moment and the people who, I don't know, nearly 2 years and 18 months ago announced their organisations were being abolished, they have been absolutely remarkable. I mean, we have the people we're recruiting are a remarkable pool of people who have continued to work on the NHS to improve it, to do all the things that they do against this background of uncertainty. And I just think it's just worth recognising that, because it is a remarkable pool of people that we're going to be recruiting from.
Yeah, I couldn't put it better. Just 2 points in response, really. The first one is just to reiterate the point that I made about the rules around the PTP, which is that we will offer all our posts to people affected by change or at risk before we offer them any more widely. So don't expect to see us advertising a lot of jobs openly, because the process wouldn't be working otherwise. And secondly, what I take from that, David, is, if we're saying by December everyone should know what their future is, we need to also think about what January to March looks like as well for some groups of staff.
okay, well, thank you very much, Jo, for the update on progress and for drawing to our attention the various risks and mitigating actions. I'm going to invite the board, please, to endorse the proposed timetable and to delegate authority to the Chief Executive to approve the refreshed PTP once you've completed your discussions with the unions. We continue to do that?
Yeah.
Good. Thank you very much.